will ask counsel to please state on the record that you have no objection to me administering a binding oath to this witness remotely.
No objection.
Ms.
Oh,
Diddle?
no objection. Yep.
Thank you. Doctor, if you will please raise your right hand. Do you solemnly swear or affirm the testimony you're going to give in this cause to be the truth, the whole truth, and nothing but the truth?
Yes,
Thank you.
I do.
Thank you. All right, good afternoon here and good morning
Good
for you,
afternoon.
Dr. Gillis. Will you please state your full name for the record?
Yes, Elizabeth Ellen Gillis.
Thank you, doctor. So I like to just get straight into it. Do you agree that Isabella Field struck Kendall Thomas with her car?
Yes,
Do you agree that Kendall Thomas was in the crosswalk at the time of the collision?
yes,
Do you agree that the collision caused Kendall Thomas's injuries?
yes,
Do you agree that Kendall Thomas suffered a catastrophic brain injury?
she suffered a very severe brain injury. Yes, brain and skull.
Do you agree that Kendall Thomas will likely require around-the-clock care for the rest of her life?
You hear me hesitating. It is more likely than not that she will require care, but at this point, I'm not totally sure.
Okay. Do you agree that Kendall Thomas will likely require assistance with her activities of daily living for the rest of her life?
Again, it is very likely that she will. However, she has some function in that right hand and arm, and depending on how she does, she may be able to do. In other words, there's a difference between being completely dependent and being able to assist with cares.
Okay. And could you just explain what doctors mean when they say activities of daily living?
Certainly. In fact, one of the tests I performed or measures, it was a questionnaire looking at activities of daily living called the Barthel Index. And activities of daily living are everything that gets you around, like being able to get up out of bed, to take care of your eating and cleaning yourself, and doing all those things that make it possible for us to get up and go out for our jobs.
Okay. So you said eating, bathing would be one,
Getting
Getting-
yeah.
getting dressed,
Mm-hmm.
brushing your teeth.
Mm-hmm.
And
Yeah,
sorry, I didn't mean to crosstalk. As of right now, Kendall Thomas cannot do any of those on her own, correct?
correct.
Do you agree that because of the collision, Kendall is incontinent and has to wear a diaper?
Because of the extent of the brain injury, currently Kendall is not aware of needing to pee or poop, and so is incontinent of urine and bowel.
Do you agree that because of the injuries from the collision, Kendall gets fatigued by communicating?
Interesting. Yes, yes,
Do you agree with the defense life care planner, Dr. Cantor's opinion that it is unlikely that Kendall will ever gain mobility in her lifetime?
when you say mobility, are you meaning walking, or are you meaning making it so that it's possible for her to move her wheelchair around, or getting in a power wheelchair and being able to move it?
Yeah, that's a good point. Do you agree with the defense life care planner, Dr. Cantor's opinion that it is unlikely that Kendall Thomas will ever walk again in her lifetime?
Yes,
Do you agree with the defense life care planner, Dr. Cantor's opinion that it is unlikely that Kendall Thomas will ever feed fully by mouth in her lifetime?
at this point, she is over a year, maybe year and a half out almost from her injury. And so it is unlikely that she will be able to eat nutritively from orally.
Okay, so you agree with Dr. Cantor's opinion regarding Kendall's ability to eat in the future?
Yes.
Do you agree with the defense life care planner, Dr. Cantor's opinion that Kendall will likely not be able to work for the rest of her life?
Yes. Mm,
Do you agree that you cannot say with certainty when Kendall Thomas's life will end?
Yes.
Do you agree that no one can say with certainty when Kendall life will end, sorry.
I think, with what we know today, yes.
Will you agree that anyone who says that they can predict the exact time when Kendall Thomas's life will end is just wrong?
I think that there is clear data about survival that would give you a range, but it wouldn't give you a date.
So anyone who said that they could tell you an exact date is wrong.
I think that's true for anyone, right? Yeah, any of us. I can't tell when you're going to die.
Sure. And so in this case, you were hired by the defense, true?
Yes.
And no doctor-patient relationship exists between you and Kendall Thomas, correct?
Correct.
And there's no confidentiality between you and Kendall Thomas because you report to a third party.
Yes.
And in this case, that third party are the defense lawyers.
Correct.
And you haven't done anything to help Kendall Thomas, correct?
Yes. Correct.
And that wasn't your goal in this case.
Correct.
And you have no intention of doing anything in the future to help Kendall Thomas.
No.
Your entire role is to analyze Kendall's injuries for the defense in this case, fair?
That was one of the things I was asked to do.
What else were you asked to do?
I was asked to first confirm that in fact Kendall Thomas had been injured in this car accident, and then the severity of those injuries. The second thing I was asked to do was to look at what is her current level of neurologic function. The third thing I was asked to do was to state what was her neurologic prognosis.
Okay. And you have done all of those things?
Yeah.
Okay. Were you aware that the defendant has denied any responsibility for causing Kendall Thomas's injuries?
No.
Do you agree with that position?
My understanding from watching the video is that there was a car accident in which the car being driven by Isabella hit Kendall.
So are you going to be giving any opinions of fault in this case?
No.
Does it surprise you to hear that Isabella Field is denying responsibility for the collision?
No?
Objection.
That does not surprise you.
That's what most people in this country do.
And what do you mean by that?
I mean, it is rare to hear someone say that they've been culpable for a particular event. The majority of people state that they weren't at fault.
Okay, so most people it's your opinion that most people in this country deny responsibility for.
No, what I'm saying is that of the cases I know, but of course, I don't know all cases. It's not
Okay.
unusual to hear that.
All right, and so you've met with Kendall Thomas a single time, correct?
Correct.
And the meeting was virtually by Zoom,
Yes,
and the meeting lasted 2 hours and 5 minutes.
yes.
Would it have been helpful to spend more time with Kendall Thomas?
It would have been helpful to see her in person. And if we'd had more time, there would have been things that I would have sent ahead and then spent more time teaching the parents to help me. So yes, it would have been helpful, but we got a lot of information from that IME.
Did you ask the defense lawyers if you could have more time with Kendall?
I believe that was just what we were told I could have.
Did you ask for more time at any point?
I'm gonna object to that because Matt, we did ask you for more time. That was what we agreed because that's what you allowed us. So
Okay.
that's not fair to ask her.
Well, I'm gonna do it anyway. Your objection is noted. Did you ask the defense lawyers if you could have more time with Kendall Thomas?
I don't recall asking that way specifically.
Is there another way that you recall asking it?
I recall we had several conversations about, or at least a couple conversations in which we discussed all the things I wanted to cover during that examination. And during that time, and I was trying to, neurologists can make a neurologic exam as long as you can imagine. I think for the purposes of this evaluation, I would probably not have been able to do a lot more, and maybe I wouldn't have been able to do a lot more because of the fact that we were Zoom and the parents and no one there was trained to do the things I needed them to do.
Okay. Did you ever ask the defense lawyers if you could do the exam in person?
No, I didn't. I was informed that that was what we were doing.
Okay. So I'm gonna share my screen and go through some of the items in your report. Can you, it's loading. Will you let me know once the exhibit loads on
Yes.
your screen?
Still thinking,
This always happens.
yeah.
You really need a new computer.
I know.
And nothing's happening here.
It just says that you started screen sharing, same as before.
All right. It looks like, can y'all hear me still?
Yeah.
Okay,
So
everything,
your screen is black and it just says
Yeah.
Matt Kahn has started screen sharing.
everything is frozen. Maybe we should go off the record for a second.
Okay,
Sorry about this.
that's okay.
Jesus.
Matt, have you rebooted your computer in a while? Like just done a hard reboot? And
No.
everything? Because even when you got on today, there's a delay between your sound and your video. So I'm wondering if maybe a computer restart? I don't know.
Is there still that delay happening right now?
Not right now, no.
We see you and we hear you. I don't
Yeah.
see a delay.
All right. Like it shut down. Usually really good about this. All right, let's see if second time works.
Okay.
Nothing here.
Same thing. Same.
All right, I'm gonna log out of the Zoom and come back in and see
Okay.
if that fixes anything. Sorry for the inconvenience.
It's okay.
I'll go fill up my, oh, he's back already.
Hopefully.
All right, fingers crossed.
Okay. There we go.
Excellent. Now I see it.
All right. So I want to go through a few things in your report and just ask some questions. So I'll flip to page 13. And you'd mentioned is Bartel or
The Barthel.
Barthel index?
Barthel. Yeah.
What is the Barthel index?
So what I was looking for were test or measures that would give us a lot of information that are well standardized and very researched, and Barthel is one of those. So it's a standard test that's used to look at activities of daily living. And as you can see, there's a whole bunch of things we need to be able to do every day. And so you can basically, as you see, there are these 10 items and you can get 10 for each, if you depending on how well you do. And of course, right now, Kendall isn't able to do any of these.
Okay. And can you sort of walk me through like each category and how it
Sure.
would be scored?
Yeah, so like feeding, she does eat a little bit by her mouth, but as Mom said, it's more for the taste of it. She doesn't really take food nutritively. And so they give the food via her gastrostomy tube, the tube in her tummy. It's also, you noticed and it was very nice that you were there, you could see that she can't really open her mouth fully, which affects how you would be able to even make a bolus in your mouth for food and swallow. Turns out that getting the food from your mouth down to your stomach is about a 30-step process. So she can't do that. And because of her motoric issues, she has such severe limitations that bathing, grooming, dressing, all of those are extraordinarily difficult to see how she would do them. But again, going back to that earlier question you had, depending on what they've been able to do to get her right upper extremity moving and usable, she may in fact be able to help with some of these. We talked about the bowel and bladder incontinence, and that really is more of a function of the severity of her brain injury, that she just you can't really start to get continence unless you notice you need to go. And one of the things that Dr. Thomas said was that she does occasionally tell them after she's gone, but not before. Of course, because of her motor issues, getting onto and off of a toilet, with the fact that she has so much truncal and neck control issues, would be very dangerous. They are needing to do the transfers for her from like the bed to the chair, or the chair to her travel chair. And of course, she can't walk, and of course, she can't do stairs. Does that help?
Yes, it does. So I guess let's use the bathing as an example. So like what distinguishes like a 2 from a 3 on the scale?
Well, I don't have the scale in front of me. I think it's more 0, 5, 10, but the whole issue is how much are you able to assist? So if she were able to we know she can pick up objects, so she could pick up the sponge and then she could bring it to her body and try to do something that would count.
Okay. And so 0 just means that she is unable to do any of these independently.
It doesn't, yes, it's not meant to imply that when you say that, it looks very dire, but it just means that at this point, she can't engage with these things. Okay. One of the issues too for her is she doesn't have much task perseverance. So if she started something, she may not be able to continue unless she were cued. So there are a lot of things that go into this, but it's a very good basic measure.
Okay. And so I know that there's a footnote here that says that a typical 15-year-old would be expected to achieve a score between 95 and 100.
Yeah,
And so you agree Kendall is not a typical 15-year-old.
well, correct. She's had a severe brain injury.
And the only reason that she's not a typical 15-year-old is because of the collision and the injuries that she suffered because of it.
Correct.
What is the disability rating scale look at?
Okay, so this one is somewhat like the Barthel in that it does do some things that are specifically activities of daily living, like feeding, toileting, grooming, but it also looks at other issues, how aroused or aware they are, how what they're able to do in terms of communication, what they're able to do in terms of motor response. And so if you look at each of these sections has different numbers, totals. But you can see that she's able to open her eyes. In this scale, 0 means you're doing it. Okay, so communication ability, she's aware of herself, she's aware of some aspects of her environment. And then I put more details in the mini mental status part that I was able to do. She is able to obey commands to move her finger on the right, her best side, and she can even move the arm. So that's again why she's a 0. Even though we're looking at her, she clearly has severe motor disabilities. So the feeding and toileting go to what we talked about before, that Kendall doesn't have any real awareness of how to do it, when to do it, and can't tell parents that she needs to do it. Grooming, again, she doesn't seem to have any awareness of needing to groom. So that's how those get scored. And then if you go down, there are 2 other things here. There's the G, which is the dependence on others. And whoop, go up a little bit. There we go. There, G. So this is a kind of a global thing, looking at for all the things she does she need a person helping her? And yes, she does. She needs it almost all the time, essentially all the time. Okay, that puts her at a 4. And then the last thing is the thing you asked before, is about employability, and that she's not employable at this time. So that's why this gives you a little more data that's helpful for me in defining how how severely disabled somebody is.
Okay. And so what is the difference then between like the 3 in feeding and then the 4 in the level of functioning?
It just has to do with how many points they give it.
So these are not points that you're assigning. There's like a standardized form that
there's a standard. All these are standardized. That's what makes them so nice, because it's not just my opinion. It's looking at her and this is what she does.
I see. Okay. So what is the mini mental status exam?
This was developed many years ago as a way for me or any clinician to look at a person in their office and help to look at whether are they appropriate in their world, being aware, knowing, includes things like who's the president, stuff like that. Of course, we didn't do all those things, but it tells you about, I know who I am, where I am, what I'm doing. I can do simple calculations. I can do naming tasks. So it gives you broad sense in a limited amount of time. You were there, you saw it, didn't take that long. Where you can really say, okay, this person is clearly scoring, the normal score is up to 30. So if you're 25 or less, it's of concern, and you move on to other tests. So we only did 6, and I was really looking again, not to necessarily be able to complete this task, but because I wanted to get a sense of how is she understanding her world. So you saw that she got the year right, but not the month. She didn't know what day it was. She knew she was at home, but that she was in Georgia. You know, if she didn't know what street she lives on or anything. When she first got the 3 objects, she answered those correctly, got them in a row, and then she was able to remember 2 out of 3. So that means already that her recent memory may be affected. I remember this is one time. So, and then I asked her, there's a thing called subtracting serial sevens, which is actually extremely valuable in looking how people are able to do calculation and they're dementing or things like that. So normally you start at 100 and you go back by sevens. I knew she wouldn't be able to do that. So I picked 20 and I said, go subtract 1. And of course she said 21. So that clearly that is a function that she's not yet recovered. She was able to name a pen and a watch, and you'll see there's some redundancy in these different tasks, but so she was able to name. So naming is an important function. With different aphasias, you might be able to repeat, but naming puts you into a different place. So
Okay.
that's what it tells me.
Is there any, oh, go ahead. I didn't mean to cut you off.
No, it's okay.
Is there any indicator of, you know, where Kendall is going, you know, from where she is now with these tests or with this particular test?
This is how she is right now. It doesn't tell us anything about how she might be in a year.
Okay, so this is a test that would just have to be done at you know, periodically to sort of gauge where Kendall is at the current moment.
This is one of the many tests one can look at to look at function in somebody who's had a severe brain injury. I might not have done this one in my office because there would be other things I could do to get the same information. Does that make sense?
Yeah, it does.
So
Oh,
depends on the clinician. Depends on the clinician.
yeah. Well, let me, I want to sort of deviate from these questions, but do you, is part of your practice doing tests like this for patients?
Yeah.
And how, I guess there's probably not a typical person with a brain injury, but how often do you like to do these tests to measure where you know a person is or how they're progressing?
Well, let me give you an example. So some years ago, one of my patients sustained a fairly, he was already someone who had terrible epilepsy and already had developmental delay. And then he had a prolonged seizure, wasn't treated correctly. So he was actually in a persistent seizure for over 8 hours. And when he woke up from that, he also had a funny kind of a migraine. So he woke up from that looking like he had had a stroke because he was slow and his functional level was so off. So in the office, I did a number of these kind of tests. Not this one because he already had trouble doing this kind of test, but you could look at this and it was telling us it mostly was left-sided brain dysfunction. And in fact, then when I retested him again in 3 months, again, then I could see that he had improved. What I find helpful is I had the advantage in the last 7 years of being in a solo practice, so I could spend the amount of time that was necessary to see where someone was functioning.
Okay. Is there I guess, is there like an ideal number of visits like annually that you would like to have with it, like assuming that you were treating a patient that you would like to do annually to kind of track and monitor progress?
Depends on what my role is. If the child or adult is not having seizures, is already involved with a rehab doctor, has a physiatrist, has adequate rehab therapies, has a good primary, what is my role? I wouldn't necessarily be seeing them every year. On the other hand, if they were part of a brain injury group where they were gathering data or whatever, they might find that very useful. One of the bigger things would be a neuropsychologist every 2 to 3 years or so. But I'd have to defer to my neuropsychology colleagues to find out how often they would want to test someone who's this age, who in fact is already a young adult.
Mhm.
So I wouldn't necessarily need to see this person much at all.
Okay, so like, and this is also new to me, with a neuropsychologist, is that something that like would be every 2 to 3 years for the lifetime, or is there some sort of cutoff?
Well, this is an interesting question. And again, I'm boarded in both adult and child neuro and adult and child psychiatry, but I mostly did child up until the mid-30s. So in answer to your question, when you look at children up to age 18, sometimes 21, the neuropsychology is done on a regular basis. Once you get to being an adult, that tapers off. So I've seen it vary all over the map, but so it might not even be every 2 to 3 years. It might only be one time as an adult.
Hmm.
I don't know. Depends on the state.
Does it taper off for adults? Because if you like, once you're an adult, you kind of plateau in your progress.
It's true that people do plateau, but if in fact you've done a couple, you're right. If in fact you're not seeing any effective change, then there, because of cost and a lot of other reasons, it may not be covered.
Hmm. If someone is continuing to show signs of progress, would it be productive to continue doing the neuropsychologist visits into adulthood as long as, progress is ongoing?
Well, so remember what I said, that there's she's still 15.
Hmm.
So there's utility in doing it, every 1 to 2 years, probably. Again, depends on how she is doing. So if she gets to age 21 and the neuropsychology tests have been very stable through that time, then I think it would be up to her adult providers as to how often they would need to do that test. It's always very helpful. The question is, whenever you're ordering expensive things, is how is it going to change what I'm doing?
Hmm. Okay. All right, so going back to the report, can you just tell me what the Moss attention test is?
So fascinating. Again, all of these are validated tests. And so this one's helpful because I was also looking for using one that we could do in a Zoom. And so this is a test that looks at your attention regulation and how you're able to stay on task, called task persistence. And do you need to be cued? Do you need to, what enables you to do focus? And as you see, one of the things that was very evident is, and you saw this in the neuropsychology done in August of 2022, that she's distractible. And sometimes she starts to loop. It's called perseveration. She'll do something and do it again. And it's not clear always what the reason for that is. But this goes to, I kind of mix things in here. I think I want to stay on this first part. So she's given a task and she won't persist on that task unless she gets cued to do it, right? Otherwise she just stops. And this is what Dr. Thomas referred to as drifting off. She will also get frustrated, and she called it dropping off. But the idea is that her mind is able to sustain attention for a relatively brief time. As you'd expect, she does better early in the day when she's rested and after she's had a rest. So you early on said that, how did you word it? That she gets tired with communicating.
Mm-hmm.
So one of the things you're looking at here is actually the influence of cognitive, physical, and emotional fatigue. So talking requires a lot of focus, a lot of energy. And so it makes sense that people get tired if they've had a bad brain injury. The other thing is that was very important in this discussion was that Kendall usually doesn't start conversations and she can't sustain conversations. So she can answer, but she can't initiate.
Hmm. And I can't remember which specific test this was. Was this the written questionnaire that the Thomas family gave to you, or was this the test that you did during
No, I
the?
think this was one of the ones we did when we were actually in the other room, when you were there, remember on that
Mhm.
table? I think this was that when we did that.
Okay, and so this is all based on information collected from Dr. and Mr. Thomas.
Yes.
Okay, is that typically how the Moss attention test is done?
Well, it depends on the age of the person, but yeah, for me, yes.
Okay, and is this a test? Sorry, is this a test that's limited to people with brain injuries, or can this be administered to a child with ADHD or
Sure. Sure. I think again, I'm someone who because of my training and experience have quite a bit of exposure to neuropsychology and learning about that. I don't pretend to be a neuropsychologist, and I found it very helpful to find measures that I could use in my office because often it gave me a fact that I could now monitor over time. So that's where I got this.
Hmm.
I would say most of these are not, the mini mental database, most neurologists do. I suspect most people don't do the Moss attention test.
Okay. Is there a particular reason that you like the Moss attention test?
Just because, like you see, it gave me a lot of information.
Okay. And then the Mississippi aphasia screening test. What is that?
This is a fascinating test where aphasia is you can't communicate, you're not communicating, but there are very many different types of aphasia. There are people who have receptive aphasias that the information coming in can't be decoded. Then there are people who have expressive aphasias that they can't get out what they want, or they get out just a lot of verbal garbage. Then there are mixtures of these. And so again, like the other test, I'm not using this to use it as a true measure because you have to do all the components for that. What I'm looking for is information that helps me understand how Kendall is functioning. So even though I put in these numbers and all that for a total score, the point is she did do some things very well. She could name objects. She could repeat many things. She had a lot of trouble with verbal fluency. And that, if you could go down to the bottom of the page, I think it's at the bottom of the page. There it is, there. So this is the photo that you show, and in a standardized test, there's a specific paragraph I state, and then they get 10 seconds to look at it, and then they say a lot of things. Well, but you were there, you saw that she really had trouble with this. And it's what she first talks about is she talks about people. And then as she goes along, I couldn't really understand what she was saying. And then she says American flag. Now, when you look at this picture, there are so many more things to look at. And that is something that when I talk about her having cerebral visual impairment, the fact that she focuses on the flag means that she may have a very specific problem because of the way her brain is injured, called simultagnosia, and she only sees one piece of this at a time. So every time she looks at it, it's like a different picture. Does that make sense? Anyway,
Sure, yeah.
so that's how it's helpful. When you go back up to the test itself. So this was what was, so again, you're looking for how does it help you in all ways? So in the receptive subscale, I think you remember with the yes, no, I was saying things like, is your name Johnson and da da da. And she was started smiling, laughing, right? It was
Mhm.
funny to her. That is so important. I mean, she's understanding, right? She gets that I'm doing silly things. So, and we already knew that she was going to have trouble with instructions that got more complicated. So I didn't do that very much. So that's how that works. Again, you have to understand, I'm not using these screening tests as they were initially meant. I'm using them to get data from it that helps me make an assessment.
Okay. So for the receptive subscale is slightly higher than, or 10 points higher than the
That
expressive.
It doesn't really mean anything. I was just putting those numbers in. I'm not using this to say she has this degree of dysfunction. I put them into, you have those numbers. More important would be the thing right above that she has severe dysarthria and laryngeal hypofunction. So I think you could hear that it was very hard for her to make words.
Mhm.
And that, and then she was breathless to do. Remember that she was like, and then her voice would fade off.
Mhm.
Okay, so that's really going to be a problem for her over time. And the fact that it's been there for so long, it's less likely that it will ever resolve.
Mm. Can you just explain in lay person terms what dysarthria and laryngeal hypofunction mean?
Sure. So dysarthria is if I speak clearly and enunciate, you would say that I speak well. But if I hard talking like this, I'm blah, or hi, you know, and they're not using their tongue to touch up the teeth or the top of the mouth, or that's dysarthria. It's you're not speaking the words well. That's function, not language. Yeah, does that make sense?
Yeah, so the problem is really like the ability to use the tongue versus like
Make
not knowing.
make the sound. Yeah, make the sound. Use your mouth. Remember, she has that
Mm.
pretty dense, it's called a central facial because it's happening at the level of the brainstem.
Mhm. And
And
so,
the laryngeal,
go ahead. No, you go ahead, please.
the laryngeal hypofunction is simply your ability to express sound, make noise. So when she starts with a little bit of she starts with a little bit of a breath, and then it's very small, and then it goes away. That's something that is a function of her. It's called laryngeal hypofunction, but it's really a function of how well she's able to take a breath and express the breath.
Mm.
If that makes any sense. It's
Yeah,
not going to hurt her. It's not going to hurt her. It's just going to make talking difficult.
makes sense. And then, so I know that the numbers on these subscales don't necessarily translate to a degree of disability, but because the receptive subscale score was higher, does that mean that she like she has more strength in the ability to understand and a bigger weakness in the ability to express?
Yeah, I guess you could say that. I mean, if you look at she got 32 out of 40 correct. And on the expressive, she got 22 out of 34. So there is a difference. Yeah. And I say that later. I mean, you can see that she has an easier time understanding what is said to her as long as it's simple, and has a harder time saying things.
Okay. And then the report, it mentions the 5 intelligible vocalizations. Can you just walk me through, I guess first, what is an intelligible
It's
vocalization?
basically a word. You can hear a word and you know that's the word. And so if you look at her functionally and what she actually did, her verbal first of all, I didn't do the task as it was originally intended. Remember, I gave her lots of time. And so in fact, her verbal fluency is not good because she can't really describe the photo or what it means or everything. But the way they have it coded by, did she have 5 words you could understand? Yes, but she
Okay,
didn't have 10. So that was why she got a 5.
that makes sense. And so like when in your report, you say there are unclear words and then the ah sound, that when she made the ah sound, that would not be an intelligible
No,
conversation.
right,
Okay,
right.
understood. Okay. All right, so I want to go through, if you, can you walk me through the underlined headings of your medical findings and what each of them means?
So I wanted you to be able to understand this. So I went through this, did all this stuff, and I went through the findings so you would have a clear delineation of what each thing was, why I did each thing. So transport was for the gross motor functional classification scale, and I went through that, I think. Activities of daily living, I did the 2, Barthel and the disability rating scale. And then I did a cognitive screen. It really was a screen, mini mental status examination. So then we go to attention, and I did the Moss attentions test. And then we go to language, and I did the Mississippi aphasia screening test. Now, if I were a neuropsychologist have a huge kit of things they can check. You say, I'm interested in memory. And they say, well, I could do these 15 tests, right? But for our purposes, what's important is to look at how is she functioning today, which is a different question. So that's why I used that test, and I think we went through that okay. Then the vision, we didn't really talk about that. So we know that there's this thing called cerebral visual impairment. And most people, when they go to the eye doctor, they think, and they are told their eyes are fine. That's because the ophthalmologist or optometrist is looking at the function of the eye, not looking at the function of the optic nerve circuitry that gets it back to the visual centers of the brain. And so if you look at the examination findings, I'm just down at visual deficits, there's a probable left homonymous hemianopia, a long word. But what that means is if I close my right eye, that's my left visual field. If I close my left eye, that's my right visual field, and they overlap. And part of why and that's important because she doesn't seem to pick up things coming from the left. Now, again, this was on a Zoom, but it fits with what was said earlier in her hospital course. So that means that on the left visual field, she picks up things here. So then she's not seeing that. And then on the right visual field, if I were able to test it, I would show you that she wasn't able to see things on that medial side. Why? Because of the way that the image gets into the brain, the left hemifields get to the right back of the brain, and the right go to the left. So that's a cerebral visual impairment in itself. But then in addition, I was interested in how is she using vision, because people who have such complex brain injuries often have abnormalities in how their brain not only sees information, but interprets it and then processes it. And there are several brain regions that do that. So this Teach CVI was developed by a consortium of it's a multinational consortium, people that specialize in this area, and they wanted a measure that could look at how to identify if there was a possible or probable CVI in young kids and or adolescents. And so this one, the Teach CVI 1, is developed for people that are motor dependent. They're in wheelchairs. So there are 19 questions on this one. And what it's looking for are things as like looks at you. Many kids with cerebral visual impairment look to the side and not at the person. For instance, one of the things I remember that she couldn't do is she can't pick out a toy from a bunch of other toys in a crowded field. It's how you can you see different colors? There are a whole bunch of questions. And what you're looking for is, do you have a positive screen, which just means you have to get more evaluation. A positive screen is that you have 33% or more questions answered positively. And she had 47% of the questions that we were able to do. 17. We did 17 out of 19. So 47%. That's a significant finding. So if you look at the actual test, there are many things that she couldn't do that are not accounted for by this homonymous hemianopia. Does that make sense?
Mm-hmm.
Okay, so that's why that's important, because first of all, if in fact she's picking up some things, patchy things, that will affect her ability to encode information, to read, to do function. So it has something to do with helping her function the best she can. It affects language, it affects writing, it affects everything.
Okay, thank you. Remove that. Hopefully we'll be able to pull it back up. Do you have any opinions about Kendall's life expectancy?
I did not address that.
And do you have the background to give an opinion on life expectancy?
I do have background, but I was not asked to do that in this case.
Okay. Back to the report. All right, I'm gonna flip to page 9. Do you see on page 9 where you identify Kendall's current medical issues?
Yes.
Which of these issues are likely to continue throughout Kendall's entire life?
If I might modify that question slightly,
Sure.
because when you say continue throughout her life, some of these may continue, but they will change. So it isn't like this is how she will be always.
Mhm.
So in terms of this, we already talked about dependency, the pain in her right knee and ankle. I don't think that's even been adequately worked up yet, so I can't address that. Her recent remote memory problems, it is likely that she is going to continue to have difficulties, but again, it depends on. Right now, she's not using any augmented communication devices. These are devices that help her. They're external communication devices that she can use to say what she wants, but non-verbally, and then it says what she's asking for. It may be one of the things she will get. So I don't know what will happen to that, because right now it appears she has deficits, and I suspect they will continue. Her attention regulation is almost certainly going to continue to be a problem. And the reason for that is because she has bifrontal damage that's so significant. The left central facial will probably not get a whole lot better. And I didn't put in the ptosis of her eye. That probably is not going to get a lot better. Not going to get worse. The aphasia, I don't really have a good handle on it yet. Clearly, she has an aphasia. It appears to be expressive more than receptive, but she really needs more a speech therapist who's used to working on this issue to see there. Dysarthria, I'm concerned that she has the amount of mouth constriction that she has. And again, it would be something that a speech therapist would probably look at with her. The dysphagia is going to continue. And I think that was an error that sends, particularly on the left. I don't know where that came from. She will always have trouble with tone. Tone begets tone. And so it's not because the brain is getting more injured. It's just that the pathways that have set up this happening, they just persist. And so they'll continue to work on this. Movement, what is striking when you watch her is that Kendall makes very little movement without some kind of stimulation. So again, we're already out quite a ways, but I have seen kids even years later do more movement. In her case, because of her severe motor impairments, that becomes less likely.
Okay, so I think the 2 points that you said that, there's no way of really telling are the dysarthria and the dysphagia, because she needs speech therapy to continue working on those. Is that fair?
That she's probably always going to have, she's probably always going to have those, but they may, depending on how she proceeds, how she moves over time, they may get some better.
Okay, and I'm sorry, I meant to say aphasia and dysarthria. You had said that the dysphagia will
Right.
probably continue.
Yeah.
So the aphasia and dysarthria will likely continue, but can change.
Well, they'll continue to be a problem. I didn't mean to interrupt you, but it depends, in fact, on what is found when she has a full speech language evaluation and an aphasia battery, because that will be much more able to decide, and then how she does over the next 1 to 3 years.
Okay. And then in terms of the knee pain, because that hasn't been properly or worked up by an orthopedic doctor yet, will you be offering any opinions at trial about the prognosis of the knee pain?
No.
Okay, so your testimony at trial would be limited to the fact that she currently has knee pain, and you would just say something similar to what you've said today, which is, it needs to be worked up by an orthopedic doctor before you can give an opinion.
I think even my saying that, I think she has pain in her right knee and ankle, and I'm in this particular instance, I'm acting as a neurologist.
Okay, fair. All right, I'm gonna flip to 19. Will you just read your first opinion?
Sure. It is my opinion, within a reasonable degree of medical certainty, that Kendall Thomas sustained severe head and brain injury on January 11, 2022. Further, that Kendall's extensive injury were due both to mechanical primary forces and to secondary brain injuries triggered at the time of the injury.
Okay, and does that basically mean that Kendall's injuries were caused by a combination of the impact with Isabella Field's vehicle and then the impact with the ground after the collision?
Not really. What it means is that the mechanical, the primary forces are the entire event sequence from impact to landing on the ground. That's primary. Those are things right then. They're happening right then. And then the secondary brain injuries are the brain's responses to those mechanical injuries.
And the brain's, you're not trying to say that the brain's responses to the primary injuries are not related. I mean, it's all related to the collision, in your opinion, right?
Well, yeah, that's exactly what I'm saying, that there are primary injuries when you have trauma, primary, that's I hit the guy in the head with a hammer.
Mhm.
But then there are the secondary things that occur because the brain responds, has had that hurt from the primary, and now is responding to that hurt, and that's secondary.
Okay. Do you think that anything caused Kendall's injuries outside of the collision, her hitting the ground, or these secondary brain injuries that were triggered by the initial injuries?
Yes,
And what is that?
during the surgery, you recall that she had first the large craniectomy done, and brain was coming out, and they had the blood bleeding under control and all that. And then you remember from the where the fracture had extended into the lambdoid, which is back here, it's a lambdoid suture. She started bleeding from there and developed that huge epidural hematoma that grew very rapidly. That caused a lot of other brain injury because now she's shifting back the other way and already injured brain.
Okay, so do you fault the neurosurgeon?
No, these things happen.
So it's not your position that medical negligence of one of the physicians caused any of the injuries that she currently has?
Correct.
Okay.
But that's not all there are other injuries too. She had aggressive need of pressors, which are medicines to keep blood pressure up. So she was having hypotension. And with that would come decreased oxygenation to injured tissues. So those things were ongoing.
You're saying that I'm sorry, I didn't catch all of that, but the
I'm
issues
sorry.
that you just said were
Okay.
pre-existing?
That you said, if I understood your question, you're saying, so I'm saying that the mechanical forces of that day and the secondary brain injuries triggered by those events, those injuries,
Mhm.
were what caused her injury. And I was saying, well, so no, there are other things that contributed. One of those was the epidural and the midline shift and other herniation. And then I'm saying, but she also was very sick. She had times where she kept on needing medicines to keep her blood pressure up.
Mhm.
When you have a big swollen brain, there's a thing called perfusion pressure. You got to get flow into the brain. But when it's really swollen, then that means your perfusion pressure is dropped. So if she was even needing meds to keep her blood pressure up, that means that definitely she wasn't getting perfused all the time. Nobody's fault. These were very severe injuries, but just as another place where you have, it's like they're little pieces. You can't measure them. You just know that they're happening.
Mhm. But none of that would have happened but for the collision, correct?
Correct.
Okay. That's what I was getting at. Okay. Your report mentions in support of your first opinion that Kendall had an initial GCS of 6. What's significant about that?
The Glasgow Coma score was designed so many years ago now, but it really is it's a measure where as a clinician to a clinician, I can say a number and you know how severely they're injured. So it can go from 3 to 15. So pretty much from 3 to 8, people consider severe. From 9 to 13, people consider moderate, and 14 and 15 are mild. So initial GCS of 6 tells us that this is already a child who has a severe brain injury. What I forgot to put in, but it's very important, is by the time she reached the hospital, her Glasgow Coma score was 3. It's the lowest it can be. So she was deteriorating, and that fits with what she was doing clinically.
Okay. Is Kendall Thomas lucky to be alive after this collision?
Yes.
All right, let's flip to page 21. Will you read your second opinion, please?
In my opinion, it is my opinion to a reasonable degree of medical certainty that although Kendall has made considerable functional progress since her injury, she remains severely disabled.
Okay, so is this opinion, the second opinion, limited to, as of your examination of Kendall, or do you have any opinion as to whether she will remain severely disabled?
This particular opinion was about what I'm finding at the date of April 12th. That was
Okay.
at that point, that was what she was.
And you say that Kendall has made considerable progress, but is it fair to say that she's a completely different person now after the collision?
Could you repeat that question, please?
Sure. So your report mentions that Kendall has made considerable progress, but is it fair to say that she's a completely different person now after the collision than she was before the collision?
Yes.
And then can you, in one of your, the bases of the, you mentioned semantic processing. What is semantic processing?
Well, it's a very simple thing. It's that I'm talking to you and you hear a word and you encoded a meaning for it. You know what that word means. Like when I say she understood humor, you understand what I'm talking about. And it's such an important thing that you can actually have humor. There's a number of parts of the brain that are involved in every function we do. It's not as simple as just, you've seen the cartoons where someone pushes on the brain and the foot jerks. It's much more complex than that. So if you have the ability to encode language, possibly, can't tell yet because we don't have the neuropsych, but that means that even if you have the kind of expressive aphasia I think she has, but she has relatively intact receptive language functions, that means that there's this possibility that Kendall will develop further more language function.
So is it your opinion that Kendall understands what's going on, but just can't express it because of the injuries?
She understands some of what's going on. And for instance, in those questions you heard me ask, you saw how many of them she smiled or grinned. So she understands quite a bit. Unfortunately, my evaluation was somewhat limited, that even though I know she can use a remote and iPad, I'm not sure what she's actually doing on those devices. And we know that say she has, given the extent of brain injury, she has good function in some areas that suggests that she might be able to improve in those areas with adaptive equipment.
Okay. Do you think Kendall knows that she's been injured?
That's a really good question, and I neglected to ask that. I know she recognizes family. I don't know. I don't know.
Do you think that Kendall knows that she's different now than she was before? I know that that's similar, but I think it's a little different.
Well, I'd be speculating. I mean, I think that someone who is as severely injured as her may very well remember. I've had other children and teenagers that were very severely injured, And yet, even though they still have limited functionality in most domains, they can talk to with difficulty, but they can remember what it was like. So, but I didn't ask her that question.
Is there a reason that you didn't ask it?
I was kind of going through everything, trying to get done in my 2 hours.
Okay. All right, flip to page 24. Can you read your third opinion?
Sure. It is my opinion, to a reasonable degree of medical certainty, that Kendall will continue to improve, though the rate of improvement will be slower. Further, that although Kendall will remain severely disabled, there are a number of factors that will positively affect quality of life.
Okay. Yeah, when you say that Kendall will remain severely disabled, do you mean she will remain severely disabled most likely for the rest of her life?
Yes.
Do you agree that Kendall will never be able to interact with the people around her like she could before the collision?
Yes.
What is your opinion of the Thomas family?
The what?
The Thomas family, Miss Dr. and Mr.
Oh.
Thomas?
I see them as very caring parents who are trying to do everything for their daughter and still at the same time have time for their other kids.
So your report under the where is it? Under the bases for your third opinion, it mentions that Kendall has a tremendous advantage in that she lives in a loving home with parents and siblings who are devoted to her. Can you explain the significance of that to your report?
Certainly. I became involved with working with children who had abuse and neglect when I was back as a resident back in the late 70s, early 80s. And then subsequently that became a subspecialty of mine. And so in addition to seeing some of those children having sustained significant traumatic injuries, then there are also the people I've taken care of that had tragic injuries occur, catastrophic, and where there were either no parents, parents who are on drugs, somebody that was taking care of the child was the one who injured them, and the outcome of those people is so far worse. You know, if you're not in a place where people care for you or talk to you, or it really makes outcome much worse. So this is so huge that they've basically given up their lives to help Kendall, and her siblings are always trying to, right? They're there. That's really lovely, and that's what I meant by that.
Okay. So by advantage, would it be fair to say that Kendall is receiving better than average care?
That one I can't really answer. I can say for the families or where had people become guardians that were taking care of them, that were providing, they all provided this level of care. I can't really talk to, it's too big of a generality.
Okay. By advantage, would it be fair to say that Kendall is in an environment where she's encouraged to continue progressing?
She's in an environment where the opportunity to develop and progress will be probably more than likely given to her.
Are most of the families of children with TBIs that you encounter as supportive as Kendall's family?
It ranges all across the board.
Where does Kendall's family fall on the spectrum?
Of the continuum, they're up there. If they, you know, and I think I say that that if they can get some support, a rehab team, other people that can support them, that will make a difference.
Okay. Do you agree that Kendall's advantage might help her enjoy a longer life than she might without the support?
Yes, in fact, and that's part of why I said that because her mom is a chiropractor, it's more likely she'll notice things. It's not to just say anything about Mr. Thomas. That's my experience because she's a clinician. And so she'll be looking. Um, there are many kids that go on to get bed sores and those get infected and they die. Many kids after TBI, especially someone like Kendall, where she can't really control her head and neck, so she can't really lift her head up or move her head to the side, and she can't independently roll to her side. She's at much higher risk to have aspiration of secretions or put something in her mouth and get a pneumonia because she doesn't breathe very deeply. Then that might be life-threatening.
Hmm. What are other common causes of death in pediatric TBI patients, or not necessarily patients, but just people with TBIs?
Well, you're talking about severe TBIs like Kendall had.
Yes.
Okay. Well, there is not a lot of large study looking at this issue. I can't remember the year, but in California, there was a very large study that looks at what were predictors of death in children that had severe cerebral palsy, which also included people that had TBI. And there were a couple things. One was if they had a gastrostomy tube, because if they had reflux, that would go up into the back of their mouth and then they might aspirate. And the other was that they wouldn't be able to, that they couldn't move, protect themselves, which makes sense. What other causes? Those are the two most common. Infection, it doesn't always have to be pneumonia. Because remember, their immune system is different now. So, she's at risk for pathologic fractures and not now, but will over time. And, people can have complications with those.
Okay. So you'd agree that it's unlikely that Kendall will develop bed sores based on her parents' care of her?
I think it's less likely.
Less likely. Okay. Do you agree that given Dr. Thomas's training, it's less likely that Kendall will succumb to pneumonia?
Less likely that it wouldn't be picked up. But again, we don't know how competent her immune system would be. So I can't say it would be prevented, that her noticing would prevent death, but definitely she might notice it sooner that she was having respiratory difficulty.
And would you agree that, given the level of attention and care that Kendall is getting from her parents, that it's less likely that she would die from aspiration related to the G tube?
That one I can't tell you because it really doesn't take much. When somebody aspirates, if there's a large bolus of aspiration, that can actually trigger the heart to stop working. So it can happen very, very quickly. So I can't comment on that one.
Okay, that's fair. So your report also mentions, and we briefly touched on this, but it mentions that having a mother who is also a chiropractor means that Kendall has someone who is more likely than not able to notice changes in her functional level and act promptly. And so by act promptly, would it be fair to say that the Thomas family is more likely to get Kendall the care she needs as an issue arises?
The way you've asked that question, I'm not sure I can answer it. If you mean that Dr. Thomas is in a position where she may notice that, boy, that right knee is getting more swollen and know to call or have Mr. Thomas call to get care, yes, that might happen. But I can't state that as categorical response.
Do you agree that by having a doctor in the family, Kendall might enjoy a longer life than someone who does not have a doctor in the family?
Well, Dr. Thomas is a chiropractor. She's not a medical doctor.
Mhm.
So I'm attributing to her based on her history and running a chiropractic practice and that she does have clinical exposure, but it's very different than being a doctor, a medical doctor.
Sure. Well, do you agree that by having a parent who is a chiropractor, Kendall might enjoy a longer life than she would in a family without a chiropractor?
I don't know.
Okay. Do you have any other opinions that aren't in your report?
No,
Did you review Dr. Alan Harbin's materials in this case?
I did not receive Dr. Harbin's materials.
Did you ask for them?
No, I didn't.
Have you reviewed Kathy Gregg Smith's materials?
Briefly, I did not spend time looking at the life care plan. The one item I did find relevant to your previous question is there was a 2 pages of handwritten notes from when she had talked with him. That basically talking about how he had that he felt that she was doing some good things. I remember her favorite singer was Beyonce, and but then he also did parts of a mini mental status. And this goes back to the fact that everything is so event dependent, because he found her repeating numbers up to 1 times 6. But of course, in my case, I didn't really have her do that exact thing. So that was all I had.
Okay. Is there anything in Miss Gregg Smith's materials that you disagreed with?
I think that somebody doing a life care plan before you even are, she didn't do anything. She didn't review anything. So how would she know if I didn't bother to read it?
So do you intend to criticize Kathy Gregg Smith's life care plan at trial?
No,
Have you reviewed Jennifer Cantor's materials?
no.
All right. Time for the boring expert stuff. Can you see plaintiff's exhibit 691?
Yes,
And is this your current deposition and trial testimony list?
yep, yes,
And have you testified in deposition or trial before July 28th, 2018?
well, it's my rule 26, and so you really have to do about 5 years, and here's 6 years, and so I didn't go back and try to find all the other ones. I guess I've testified prior to that.
Okay. When in your entire career testifying, what's the breakdown between people who are injured versus people who are being sued for causing injuries?
Well, I would say 90% of my previous testimony was in cases of child abuse and neglect for both defense and prosecution, and that would have been criminal and less likely civil matters that didn't come up. Dependency court. So of the ones that I've done specifically as medical legal, I would say 70 or 80% are injuries. Well, they're all injuries of some kind. I mean,
I guess in terms of the medical legal work, what's the breakdown between cases in which you've been retained by a plaintiff who is injured versus a defendant who is defending claims of
Well,
negligence?
again, that's what I'm trying to tell you. I was always approached by the defense or prosecution or plaintiff, but in the ones that are all child abuse ones, there were, I would say it was probably 80-20. And of the ones that I've done since I started my solo practice in 2015, I would say it's pretty equal. It's probably pretty equal.
So 50-50 for plaintiffs and defense.
Yeah. Yeah, I'm trying to think of the cases. Yeah, it's pretty equal.
Okay. And this is a relatively short list, so we'll go through it. This 2018 deposition, were you retained for the defendant?
No,
Matt, hold on. I'm sorry. You're echoing really badly. Like you're starting to like reverberate or whatever. So I'm hearing things twice and I'm missing portions of what you're saying.
Are you still having that?
Yes.
Oh.
And
Okay.
now like when I'm talking, I can hear myself back after a little bit too, but on your side, if that makes sense.
I don't know.
Is that just happening to me? Dr. Gillis, can you hear that also?
I'm not hearing that.
Oh, okay. Okay, well then maybe it's just me. Sorry.
No, it's not just you, because it's been doing it to me off and on since we started. That's what I was speaking of earlier.
Okay, all right. It's gotten worse over the last like 20 minutes or so though, but this last question that you asked, I only caught like half of it. That's why I stopped you.
I don't know, Ms. Dibble, if it would help if you muted when you weren't speaking. I don't know if sometimes that helps. If it's just the two of them, but I have no idea where it's coming from.
Okay.
So I just changed a microphone setting. Has that fixed it?
You do sound a lot clearer now to me. So
Okay.
I will stay quiet. Let's see if we just get through this.
Okay. In the July 28, 2018 deposition, who retained you?
That was a civil case, and I was I wasn't really retained. It was really a question of I was a percipient witness. So it was just, I can't remember. I think it could have been plaintiff. I was really just being asked about neurologic care that was provided while this child was inpatient at Carl Foundation Hospital. And I wasn't named in the suit and it disappeared. So all I did was the deposition.
Okay. What the June 2020 deposition, who retained you in that case?
Mr. Lieb, Sam Lieb.
And was he the plaintiff's attorney or the defendant's attorney?
Defendant.
And the November 23, 2020 depo, who retained you in that case?
Plaintiff. Actually, I'm sorry, that was defense. That's
criminal defense, though, right?
Yeah. Well, it's a juvenile court matter. It wasn't criminal. I mean, it was criminal, but it wasn't.
Okay. 2021 October, who retained you in that deposition?
Again, that was Sam Lieb again
For the defense?
for the defense.
2022 April 6, who retained you in that case?
That was the trial testimony for the deposition that happened previously.
Okay. 1, 2, 3. All right. Has any court ever ruled verbally or by written order that you are not qualified to testify as an expert about any subject?
No.
Has any court ever ruled verbally or by written order that some of your testimony or a portion of it was not going to be admitted for any reason?
No.
All right. Can you see plaintiff's exhibit 693?
Yes,
So I just want to go through this and I'm going to get a little thing to annotate it. Did Kendall Thomas have any interference with her normal living because of this collision?
I think we've been discussing that.
So is that a yes?
Well, I'm concerned about this checklist. Because yes, she doesn't have she says pain and suffering, but yes, she does. She is not currently living normally like she was.
Okay. Has Kendall Thomas had an interference with her enjoyment of life because of this collision?
It's a very curious question because it implies that she is fully aware of, she clearly is having joy in her life. So, but she is different now than she was before. So is she like how she was? No, but she still has enjoyment. So when you say interference, I'm not sure I can answer that question.
Okay, so we'll put a question mark there. Has Kendall Thomas suffered a loss of capacity to labor and earn money because of the collision?
Yes,
You guys can keep answering, but I am going to place an objection on the record to this exhibit because Dr. Gillis is not testifying regarding any of the alleged damages that the plaintiffs are claiming. She's the neurologist, the pediatric neurologist that conducted an independent medical examination, and she's talked about her exam and her findings. But these are, this is outside of her scope.
Okay, noted. Dr. Gillis, has Kendall Thomas suffered an impairment of bodily health and vigor as a result of the collision?
she has had an impairment of bodily health and vigor. She has not suffered. She is not suffering right now. She just is impaired. So that's a yes.
Yes.
For the next 1, 2, 3, 4, 5, 6. For the next 6 things, I can't answer those.
Okay. And why can't you answer any of those 6?
Because it implies that I know that in fact she recognizes that she was different before and now. And you say fear of extent of injury. I don't even know what that means. Or
Okay.
shock of impact. At the moment of impact, she became unconscious.
Okay.
Actual pain and suffering in the past, have no idea because she was spent so much time being, she was comatose for a long time. She was really at a rancho level of 2, 3. I have no idea.
Okay.
Right now, she has only pain in her knee and ankle. You and I have no idea if she's suffering. What does mental anguish in the past mean? Does that mean her entire past? Does that mean just since the accident? Mental anguish in the future. Again, it implies that she has competent mental functions, but in fact, she has very severe multifocal brain injury.
Okay. Has Kendall had to limit her activities because of the collision?
She has had to limit her activities, but that is not what that is not, when you say check, I don't know the extent to which she must limit.
Okay.
So I'm not
Should
answering
be.
that question. Should be, does she have limitation of her activities? Yes.
Should we put a check mark or a question mark?
I'm just telling you that the way it's written, I can only tell you that she must limit her activities.
Okay. Save this. Okay. Those are all the questions I have.
I don't have any questions. Thank you.
Okay.
Thank you for your
Well,
time.